It is truly ridiculous that they don't offer conservative-based options for patients when there's peer academic, well-researched alternatives that are out there. You need to try and find a physician that's going to use science-based approaches that are conservative-minded, and I'm convinced that the reason why a lot of physicians, a lot of clinical offices don't offer those options is for money. I'm Dr. Murray at Murray Natural Integrated Health, and just want to bring up a couple points here today. I've got lots of patients that come in. They say, they're not doing the testing that I'm asking them to do. And they're not offering me any kind of conservative-based options. They just want to go to the first thing that they can, the medication that everyone else is doing, treating me kind of that cookie cutter type of approach. For instance, when a patient came in and they said, hey, you know what, my blood sugar has been coming up. I went in and I'm in a pre-diabetic area, and they're recommending that I take metformin, a couple other medications to try and bring those numbers down. And I asked, well, did they recommend that you take a conservative approach, like change your diet, perhaps even exercise or do some things like that? And they said, no. They just said, here, take this. And I actually asked them, can I take something or do something different? Can I take a supplement? Can I an exercise regimen? They said, we recommend you do this, without even recommending truly any diet and lifestyle recommendations. Now, one of the reasons why the dietary and lifestyle recommendations come a second or third or fourth place is because it takes time to make those recommendations. And I'll tell you this, and even in our office here, if I see 4 patients in an hour, so 15-minute increments there, and I charge it out as 15-minute visits, I'm going to make a whole lot more money charging out 15-minute visits as opposed to charging out a 1-hour visit to an insurance company. Same amount of time, but I will get paid more for seeing 4 people. Now, 15 minutes is usually a lot of time, actually, to see a lot of your medical providers out there. So usually it's like 5 minutes or 10 minutes. It takes time to do active-based care where you have involvement in it, because there's an educational component. That's one reason why the dietary and lifestyle recommendations and some of the more conservative options aren't utilized. But here is a good example. This is a publication from Quest Diagnostics. Now, they talk about here, this is a publication actually for cardiologists and for those who are doing cardiology type testing. And so you'll see in here a discussion about different lipoproteins, different cholesterols that can be tested, and different treatment approaches when those cholesterols are not where they should be according to medical standards. There is an understanding in the medical literature now that just total cholesterols, that's not all there is to know about heart disease. In fact, there's some people that have a 300 cholesterol and they never have heart disease. And other people have 120 cholesterol and they have heart stents being put in twice a year. So there is an understanding of cholesterol particle size testing and other lipoprotein testing, such as Lp(a) and Lp(a). I've mentioned this on our Facebook page multiple times in the past. That's going to be one you're going to see come up in the near future, being tested on a routine basis from your providers. New studies came out here just recently showing that cholesterol medications such as statins do not lower Lp(a). But the B vitamin niacin does. And in this publication, and this is a standard medical publication from Quest Diagnostics to those who are doing cardiology related type testing, blood tests, in the back page here, it talks about all the different lipoproteins you can test, which is a more extensive test than just looking at your total cholesterols. But also, for instance, those that have triglycerides elevated. Yeah, it recommends in here a statin medication, right? Some of your cholesterol medications like statins. But also fish oil. Why is fish oil in here? Because fish oil, you can get a prescription of it, and it's FDA approved with helping with triglycerides. But you could probably go get some fish oil, and a substantial amount, and a good quality one, and you can also test and see if you have enough or not. There's an omega-3 test that we do on a regular basis, and it's a cardiology type test, but it's an omega-3 test, and if you're not taking enough, you can see it. How about another one here? That LP little a that I talked about. The studies coming out showing that LP little a, which is an inflammatory marker basically on the heart and on the vascular system. And they're showing that statin medications do not lower your LP little a. That's exactly what this publication says right here. LP little a, this inflammatory marker in the heart. What things help to lower it? Well, statins don't, that's for sure. But niacin, the B vitamin, niacin does. Why don't they recommend those things? Why don't they recommend it? Because it probably, niacin, yes, you can get a prescription of it, Niaspan, but you can also take it over the counter, and that does not make any pharmaceutical company any money. That is the reality, is that money talks, and money talks in the healthcare system. So the active-based care that comes into the dietary and lifestyle recommendations, which, by the way, are seen in this publication as well, dietary and lifestyle recommendations can help with cholesterol levels. But the LP little a, of course, niacin is one that's noted there. But those kind of active-based care recommendations, when you start talking about dietary and lifestyle recommendations, those things are not covered by your medical insurance, because at least not more so, not as easily, because it takes time for that educational component. And then also some of the, if you're doing a supplement for it, your insurance most commonly isn't going to pay for it either. That's the other thing, is that other patients will come in, they'll say, well, I want the LP little a testing done, or I want the particle size testing, or I want hormone testing done. I want to have stealth virus testing done. I want to have those things done. I go to my provider, and I have Medicare. I have the VA insurance, I have this different insurance, and they won't do the testing. Well, your insurance doesn't want to do it. There's lots of reasons for that, but it's not actually perhaps in their fee schedule. If it's not in the fee schedule, your provider, they don't want to do it because they don't want to get audited and have that money taken away from them. You are responsible for your health. You're in charge of your health. And if they don't do it, you need to find somebody who will do it. The particle size testing is just one example of that. Your sex hormones, if they won't test those, you need to have those tested. If you have a really shoddy immune system, you're catching everything under the sun, or you have a lot of inflammatory conditions going on in your body, you're not deficient in ibuprofen, okay? There has to be a reason for that. So it's incumbent upon you and I to take our health in our own hands. I don't mean do something dangerous. Talk to your medical provider about these things. But if they're not willing to look into things for you, then go to someone who will. Your health is more important than sitting back and just taking a non-steroidal anti-inflammatory or worse for your pain conditions. Get to the root cause. Lots of things to help the immune system. Ozone therapy, IV, intravenous therapy. We do those things in our office here. We do the testing I'm talking about. We do EKGs and spirometry and different lung function tests, because we're not trying to actually just test to find out if somebody's sick. We're trying to test to see if somebody's actually getting better. True health care. So the nutritional recommendations and the hormonal recommendations and the IV and ozone recommendations that we're doing here, we are trying to actually get people to an optimal state of health. Now that sometimes takes time. And I realize that sometimes if your Medicare doesn't pay for something, doesn't pay for time, because Medicare doesn't want to pay for time. They want to pay for the 5 minutes in, 5 minutes out. Yeah, you might have to pay for time, but you know what? Paying for that time is paying for your health. And that's what we're all about here, is trying to get to root causes of problems, looking at those conservative options, and also getting people into crisis care when they need to. So your health is your health. Take care of it and find a health coach, a health provider that will work for you. Have a good rest of your day. This is Dr. Murray from Rare Natural Integrated Health, setting the standard in natural health care. Have a blessed rest of your day.